10 months?
10 months, almost 11.
Catch it over the shoulder.
All right, man, let's go back here. Let's show them
Instead of the
this.
back shoulder. So
Hey, look, let's see if we can. So,
What's happening?
check this out. See if you can put it in there.
Deuce.
Do most vets have just like,
Oh yeah, from the bottom, that's right.
And then you can pick that up. They just lock it so they can't bust out.
guys, we're gonna see if Deuce can fit in here. He tiptoeing.
That's crazy.
Yeah, you can have that. Come on. Good boy. Yep.
I bet he'll go in the other ones.
Let's go see. Let's go see.
Oh, the big one in here?
Yeah, the big one. So the combination side of this thing. Oh man, this is huge now.
It's a little more feasible. Good
He'll probably
boy.
gladly walk in.
Good
It's a lot
boy.
easier to consider it, right? So how important do most vets have this type of facility in that thing?
Oh sure, if they're gonna offer any sort of boarding or medical board or hospitalization, they're gonna have some sort of combination of this.
Just to make sure that the mastiffs have somewhere to hang out.
Oh yeah.
We wanted to see you in the small one, see how you fared, man.
You wasn't having that.
At all. We're back with Dr. Tadlock, and we have Jamarcus, aka Better Best Dog, and our guy Deuce. Now, a couple things we were concerned with early on is definitely, well, he's giving me something to be afraid of. And not for my sake, because my dogs are good. But, unfortunately, we've seen some shaking in Deuce's back legs before. I don't know, do we have those clips still?
Yeah.
Okay, so Jamarcus will overlay that so you could see, and when he's standing still in the cage, outside of the cage, in the yard, those back legs begin to vibrate. So doctor said, hey, does he bunny hop when he runs, and why is that a sign?
Oh, when they're bunny hop, so a normal dog, if they're running, if you slow mo, there's a certain cadence of their legs. When they start bunny hopping on their back end, there's usually something wrong with the hips. And there's one disease process that's, classic textbook bunny hopping. And that's gonna be hip dysplasia. Now we can only diagnose that after shooting some x-rays.
Yeah.
But it's one of those questions, hey, is this happening? Is this? All right, let's shoot the x-rays. And kind of, without me even putting my hands on them yet, you can kind of already know where I'm going.
Let's give us a breakdown. Let's go ahead and fill me in. Now, guys, you saw Tadlock breakdown our dog Cha-Cha. And I tell you, it was eye-opening. And hey, when I posted a video on my page, IG, people were like, "Yo, after 10 years, I just too met a vet, and that was the first time I ever saw that done." So I don't know if it's something new that's being implemented in vet school, but there are a lot of people who are not getting the care that you're providing.
Yeah, I'm glad another vet is.
Yes, yeah, at least one more, right?
Yeah,
so
makes me happy.
you and me both, right? So go ahead, man, give us
All
perspective.
Right. Let's
if you
stand
don't
him
mind.
up. Stand up. And I'll just have you at his head. I know you're still a puppy. He fought that pretty good.
It's like some yoga stretches right here, people. Ooh, boy, he's stretching that booger, boy. I wonder if I can do those stretches.
Yeah, that's hurting. Come on, buddy. You're almost done.
So Mark is trying to control the big dog. It's funny.
It's the same size as me.
Yeah, he definitely hurts in those hips.
Okay.
So start extending them out, and you see him kind of really shift his weight and pulling that leg away from me.
Yeah. So what is it? What's the future of this look like based on just a light assessment without any x-rays?
If it is hip dysplasia, over time it's just going to get worse and worse and worse.
Yeah.
The good thing is if an owner has enough money, I hate talking about money, but a board certified surgeon can do a total hip replacement.
They do hip replacement now for dogs.
Oh yeah.
Oh shit.
I think it's running, at least in this area of the world, I think it's running about 10,000 per hip.
That's what
I think
is.
it's 7 to 10 per hip. I think.
And what did they do to replace a dog? I mean, I know what they do with humans, but you go, damn, they do it on dogs now.
Yeah. So what they do? So wish I had a little diagram or something. So they cut the femoral head and neck off.
Yeah.
And then they put a new one, a metal one, titanium, I think it is. Put a new one in and anchor it, and then they do something with the acetabulum, which is like the socket that femoral head goes into. So you have the ball and socket joint. They do something to it, and it's a new metal one that just, I mean, perfectly rotates.
And you know what's crazy? In humans, if you get a hip replacement in 10 years, you got to get your hips rechecked and sometimes replaced again.
It's still the same, but how many dogs are
Gonna live to 20.
living long enough to have to, unfortunately?
This is not funny, but it's kind of funny. Oh man, so is there anything else that you would tell them to be mindful of when dealing with your larger breeds who are more prone to hip dysplasia, and is there a reason why they're more prone to hip dysplasia?
It's a genetic deal. I don't know if we know the full extent of it, or at least I don't. Is there one genetic marker? I don't know, going down that pathway. The big thing is we don't want to limit his exercise, but at the same time we kind of do, because it hurts. I mean, if you're saying he's sitting there just trembling,
yeah.
I mean, something's hurting. That's going to be the hips, which you're going to have a little nerve pinch potentially, and that's what's getting the...
You know what's interesting, man? I sent Ruben a video on my phone. He says, Trevor, I don't like how them back legs are turned out.
It could all be hips. I mean, 'cause it starts at the top, works way down.
Yeah. Then he has to make adjustments the rest of life just to move around.
Yep.
Man.
I mean, so like this would be a dog I would already be talking about, like joint supplements and whatnot, just to help. I mean, just protect the joints as long as possible.
Man, food for thought, people. Jamarcus says somebody who's training the dog, man. What are your thoughts on this?
As far as how he's acting right now?
No, not how. From a trainer standpoint, just, you got to go back and kind of talk to the guy who sent him and put him in your possession and is thinking about getting more kind of Corsos.
Yeah.
How do you parlay the message outside of it being out there for the world to see at this point?
Well, I mean, you just gotta be 100% with them. I mean, that's the reality of the situation, and it goes back to the things that we've talked about in previous videos as far as making sure you do your research before you just go buy a dog. I mean, because this could also been prevented, as preventing is progressing. So if you had done the research, then you'd had a better understanding of what you might have been getting. But I mean, at the end of the day, most people don't know these things. So like, really take the necessary precautions, do your research, talk to people you do trust in the space. When it comes to, getting a dog that you want to bring into your life, because as you heard, now it's going to start costing potentially more and more money, and all you can do at this point is just try to maintain it.
Boom. Boom, boom, boom. Guys, no, we don't want to scare anybody. We don't want to scare Ferran, because we're going to continue to do food, and as the doctor said, definitely, adding some supplementation and trying to add value. But at the end of the day, hip dysplasia is hip dysplasia.
Yeah.
It's just is what it is. So is there anything else that people often have checked with the kind of Corso? I don't even know.
That's the big one that I see. Over time, do they develop allergies? Treated a few with some allergy problems. But that's really just structural, and allergies are the biggest ones I've seen.
Boom. There you go, people. Take care of your dogs.